The embassy has been a partner with the government of Barbados for many years, and we were very proud to be able to assist with developing and building this lab and putting the equipment, state-of-the-art equipment in here. We have continued to work with them as far as training individuals on how to use the equipment, as well as making sure that the equipment is properly maintained. Right now, we are working with them to give them another $400,000 to make sure that they have the things they need to continue to do to respond to the COVID pandemic. Some of that is the PPE, some of it's reagents, some of it is other equipment that may be needed. We have a CDC representative at the embassy, and she has been working very closely with the lab to make sure that we have the things that are needed and appropriate for the lab at this time.
Currently, we have done probably more than 25,000 tests since we started testing in late February. And that number, in terms of the number that we do per month, has gradually increased and will continue to increase as we have more visitors, as our protocols dictate that persons need to be retested while they're on island. It means that you'll have more testing going on as the months go by, and so that testing number will continue to increase. Monthly, it will continue to rise. What we've had to do is hire 5 additional staff members to complement the staff in the molecular department. We were only running on 5 persons, and we have another 5 because we actually do testing from 8:30 in the mornings as samples come in, and the last person leaves around 12. And even that depends on the volume of samples, because some of my staff actually left this morning after 3 a.m. just to ensure that we can meet that 24-hour turnaround time that we give the persons as our turnaround time. In terms of the testing capacity that we have available on island, what we've been doing is continuing to buy all the reagents and supplies that we need to try to keep ahead of having enough test kits. So we probably have more than 90,000 tests available currently. In terms of the swabs, we have quite a lot of those available as well. And as was said before, the U.S. government continues to help us. They help us to buy a lot of supplies as well, because we only talk about test kits in terms of the actual tests. We will talk about staff, but there's a lot of other little things that go into actually producing a test result. And they've helped us to buy a lot of that stuff as well, and they continue to support us. And I think they even purchased some additional supplies for us just recently, just waiting for them to be delivered. So we do have a lot going on. The government has invested a lot and continue to provide us as much as they can, but we also have the kind donations of all the other organizations that do also provide stuff as well.
But every now and then we have issues where causes us to be very not happy in a few cases. And many of you know that's the role of the COVID monitoring unit. And they have been working to make sure that our villas are safe, our hotels are safe, and our churches and places of social discourse are all safe. So generally we have a good grade, but as more persons coming to the island, I keep saying that we cannot keep our guard down, and we need to be ever vigilant. We're going to be in this for the long haul, and therefore we expect the cooperation of every Barbadian citizen.